Okay, Assalamualaikum warahmatullahi wabarakatuh and very good morning to all of you. Okay, so yeah, we're coming for the second session for topic of the shorter the better. Okay, can we start with our discussion on problem reformulation?
Here we have 50 years of innovation. Diagnosed with fever and hypovolemia due to nosocomial infection.
Okay, so how can we relate to the learning issue that we discussed on the previous discussion?
The learning are what is nosocomial infection?
Okay.
Types of nosocomial infection. What are the predisposing factors of nosocomial infection? What are the ecological factors of nosocomial infection? What are the consequences of nosocomial infection?
Okay.
Sources and modes of transmission of nosocomial infection, and prevention and control of nosocomial infection.
Yes, that is the one that I'm looking. So, 50-year-old man with nosocomial infection due to catheter-related bloodstream infection caused by MRSA. So, the discussion today is basically around that use. Okay, about what is going to be defined by nosocomial infection, catheter-related bloodstream infection, which is caused by MRSA. Okay, so what is the principle of management that you find?
But then the arrow shows the system, right? So it doesn't mean the types of animals. It means the types of system.
But we need to figure out the new issue.
Yeah, I understand. But the problem is
Then we need to see stuff.
maybe maybe the arrow can say, yeah.
Tissue transplant is not nosocomial infection. Tissue also transplant also can
How about the DSI? Do you think another arrow from the types of animals?
PRBSI. So what is PRBSI? PR is catheter-related bloodstream infection. So basically, bloodstream infection is due to the infection of the catheter. So the thing to focus here is about the virulent infection which is the biofilm. So CRBSI is the infection, whereas from a bacteria sitting from biofilm that form either inside or outside the catheter. When we inject the catheter, the biofilm will start to form. How it forms is this biofilm itself. The meaning of this biofilm is structured community of bacteria, which includes in self-producing matrix. Once we inject the catheter, the bacteria will form a community surround the catheter cells, which is inside our organ. Once we inject inside, so once the bacteria attach to this catheter, it will form a community of colony, forming more bacteria, and then form a biofilm. We need our immune response is we need the circulation of blood in order for the antibody to move to the site of infection and then the formation of this biofilm will actually prevent the things that is required for immune response to reach that certain type of infection.
We use biofilm, the kind of biofilm blocks the flow.
But it is not fixed for my brain. So, lambang,
Why?
I don't know.
No, I need
It's not
that.
memory term.
Because you not very understand about it, so when we have to use
How can the facilitator help you in understanding or come up with something that you understand in the learning issue? How? Make the learning issue more specific. For example, in this topic, what would you like to have before we come up with the core learning issue? What you expect it to be? Do you understand my question? No. Okay. For example, the first learning issue is to define the nosocomial infection and the relation between bloodstream infection. So, how specific that you are going to be? If I'm not arising that relation, how? What your expectation?
I think it's all the specific. So I think that's why we should ask about that. Do we understand about that learning issue? Not something as we are not sure that what we should find about that learning issue.
Understanding of the meaning of the learning situation. We need to find something else, but not something.
For example,
like age, theological causes and predisposing
factors.
It's almost the same, but then it's got different. So for the first session, I was confused. Which one I have to find? Like, what does it mean by causative and what does it mean by predisposing? So after discussing with my friend, then I have to know.
Oh, okay.